In this video, I want to talk about the 3 things that you need to know so that you can fully get rid of a supraspinatus tendinopathy, a rotator cuff injury, a shoulder impingement, any of these things. There's 3 important aspects that you have to cover. So if you want to know what those are, then stay tuned in this video. My name's John, I'm a sports injury therapist, and here at this channel, I want to be doing 3 simple things. Help you to get to know your body better so you can get rid of your pain and weaknesses and ultimately strive forward and hit your health and well-being goals. But in this one, we're talking about a common one, the rotator cuff, or you might have been diagnosed with a supraspinatus tendinopathy or a shoulder impingement. I'm going to dive in this video to exactly what that is, when it happened, why it happened. But as I mentioned, there's 3 key factors that you need to get in place if you're going to make sure that you get rid of any pain associated with that and get back to doing what you want to be doing. And hang around to the end, because the 3rd one is probably the one that frustrates me the most, because I think it's missed by other medical practitioners when I'm working with patients and they haven't covered this aspect. So it's probably the most important one. So hang around to the end of the video because it builds up to that stage. But firstly, what is this supraspinatus tendinopathy or a rotator cuff pathology? Well, the supraspinatus is one of 4 muscles that make up our rotator cuff. The rotator cuff are the muscles that hang on to the shoulder blade. So the shoulder joint, or what we might call the glenohumeral joint, is what we call a ball and socket joint. So the end of one bone, so the top of the arm bone is a ball shape, and the shoulder blade here is a socket. Now those joints are great because it allows us loads and loads of movement. But the problem that we have at the shoulder is, as a joint, it's the least stable. We don't have loads of stability around this joint. So we have these 4 rotator cuff muscles that give stability to that joint. And that's an important word, stability, that I'm going to dive back into later. But in the case of the supraspinatus, supra means on top of, spinatus being the spine of the scapula. This is the muscle running along the top of the shoulder blade here. So if you can feel that bony element at the top of your shoulder blade, that's the spine of the scapula. And then you almost feel a gap or a dip in the muscle there. That's where your supraspinatus is living. Now, why is this muscle so problematic? Well, what we have here in the shoulder joint is this space between the top of the arm bone and the shoulder joint itself. We call this a subacromial space. Now, the supraspinatus muscle pops along that groove and comes out of that space here into a tendon. Now, the problem is that leaves it susceptible to being caught in this space. So when we lift this arm, we often feel a pinch at around 90 degrees. We can get a pinching, catching sensation. Now, the tendon isn't the only thing passing through there. We've also got nerves passing through there and some of the other tendons of the other muscles. So if we get that catching or that closing up of this space, it can often be a big problem for us, and it can cause lots of pain down the arm and that real pinch point when we might be lifting weights or even doing everyday activities. But we particularly find it to be problematic when we get that arm to around 90 degrees. So what are these 3 things that we need to do? If we are suffering with pain, if you're feeling that catching, what are the 3 things you need to address? Well, we need to be addressing flexibility, we need to be addressing strength of the rotator cuff muscle, and that all-important one that I'm going to talk about more at the end of the video is that stability of the muscle. So firstly, the flexibility of the muscle. What can happen is that the muscles can become tight around the shoulder. And when these rotator muscles become tight, it can clamp the joint in place, make it not move around freely, and actually we can develop inflammation at the tendons as a result that leads it to catching in this space. So how can we see if our flexibility is good around the shoulder, particularly in the case of the supraspinatus muscle? Now, let's talk about what we know. The supraspinatus muscle has the stability function, and it also has an external rotation function of the arm. It helps with external rotation of the shoulder. So what we need to do to stretch it or to test its range of motion is take it the opposite way into internal rotation. So what we can do is simply take the arm up the back. Now, what you're looking to do is reach up the spine as far as it will go. That can give you a guideline of how much mobility you've got. And what I would encourage you to do is firstly, do it with the uninjured side. So that will give you your normal benchmark. So if you've got a bad side and a good side around your shoulder pain, take the good side first and reach up as far up your back as you can get. Mark at that level spine of what you reach to, and then try it on the right hand side. Do you feel a restriction? Do you feel pain? These are all things that are telling us that actually we might have a loss of flexibility in that area, and that's something straight away that we want to work on. How can we make it more flexible? Well, we can do a couple of things. We can look to stretch and we can look to roll out that tissue. So firstly, stretching. Well, this is where I use what I call the towel dryer stretch. But if you take something like a towel or a stick and pass that over your shoulder, so if you take the good side, on the side we're not looking to stretch, chuck a towel or pole over that side of the shoulder, grab hold of it with your arm in that internally rotated position at a comfortable place, and then simply pull up from the top. Now, what you should be feeling here is a stretch around the back or top of the shoulder. That's when we know we're catching that sweet spot. So we can pull that towel pole as much as we can until we get that stretching. Don't force pain, don't overforce the stretch, but just hold that stretch in a comfortable position for 30 seconds. You can look to repeat this stretch daily and you should start to see that your mobility improving, and that might well lead to a reduction in your symptoms. So then we know we're onto a winner. But what we can also look to do is look to roll into these areas. So working into the back or the top of the shoulder can be really helpful with something like a lacrosse ball. For those of you who follow my content, you'll know that I'm often talking about lacrosse balls and how much I love them. But these are great to really just get in and find those tight bits of tissue. So you can do this either standing or lying down, but by applying the pressure on the back of the shoulder blade into the ball and feel that shoulder blade roll around until you find those sore points. You'll hit those points where you think, oh, there's the sore sensation. That's the bit that we want to hang around on. Roll into that. You can spend 2 to 5 minutes rolling into that tissue. But once you find those small points, hang out on that bit, roll that out. And as we start to increase the tissue quality, you should start to see an improvement in your mobility and a reduction in your symptoms. Then we want to work on, once we get the flexibility right, another thing that we can couple in is strength. Now, what I tend to see is a lot of medical practitioners turning straight away to strength. And there's not necessarily anything wrong with that, but I think it's even more important to get the first element being the flexibility and the third element being the stability that I'm going to come on to, right? But we definitely know that strength has a part to play. So what you might typically see is people using things like bands in the gym and doing external rotations. But this is an exercise that I often see being done wrong if we're targeting the shoulder and the rotator cuff. If you want to hit those particular muscles, we need to make sure that the shoulder is kept stable. In order to do that, tuck your elbow right into your ribs and keep that fixed as you do the exercise. I often see people allowing the arm to come away from the body, and then they'll be using a different muscle altogether because the muscle isn't being kept in that stable position. So again, when it comes to strength work, I would look to do this perhaps every other day, looking to do about 6 repetitions on each side with 3 sets, and really just looking to apply the right amount of force that makes the shoulder work without bringing on pain. But as I mentioned, a really crucial component for me, and the one that I really home in on when I'm working with patients in clinic around the rehab cycle, is to get the stability of the shoulder right. Because we know, as I said, the supraspinatus is a key player in the rotator cuff, the most commonly problematic one, but we know that the rotator cuff has this role of stabilizing the shoulder. We have bigger muscles that are really designed for moving that shoulder around and creating power at the shoulder, like your deltoids and things, but we want to hit these rotator cuff ones. So it makes sense to me that we want to target the stability, and that's where I get my best results when I'm working with patients. So what we can look to do here is do a simple stability test of the shoulder. Now, you can start by going onto your hands and knees and placing your hands beneath your shoulders. Now, what you're looking to do is reach up and touch the opposing shoulder. But as you do, you want to keep real stability in the shoulder of the one that is still in contact with the ground. The natural thing to do would be to allow yourself to wobble as you go through this exercise. But what you want to do is maintain the shoulder position so that we know that we're actively working those rotator cuff muscles. And that's when we're going to increase stability around the shoulder. If that's too easy right from the get-go, or it becomes too easy as you progress through your exercise cycle, then what you can do firstly is slide those knees back. The further back you take the knees, the harder the exercise is going to become. But then you can look to progress onto going up into a high plank or top of press up position where you've really reduced the base of support, which means there's going to be more of a test on the stability of the shoulder. Again, always constantly looking to compare good side to bad side to see if you can make those improvements. But as you get stronger around the shoulder, as we get more mobility around the shoulder, and crucially, as we get more stable at the shoulder, that for me is the hat trick in looking to improve the amount of stability, strength and flexibility that we have at the shoulder, which should reduce the amount of symptoms that you're suffering with if you are suffering with this supraspinatus tendinopathy or any of the rotator cuff injuries. Now, also, throughout the program, what you can do is some of the symptom managing things, some of the conservative means. So things like ice or anti-inflammatory means being applied in and around the shoulder can be helpful. So what we're looking to do is reduce the amount of inflammation in this vital subacromial space so that the shoulder can move around happily. But long term, you want to hit that hat trick of increasing the flexibility, building the strength, and ultimately making sure that the shoulder is bulletproof and nice and stable. I hope that's been helpful. I hope that gives you some things to work on. If you have any questions, do drop them below in the comments. I always try to come back to all of the comments as I greatly appreciate them. And the other thing I greatly appreciate is building this community, helping others just like you. So why not hit that subscribe button, hit the like on this video if it's been helpful content, because that's going to show that video to other people and help them along their journey to rehabbing those frustrating supraspinatus and rotator cuff injuries. But I look forward to seeing you on the next one.